Impact of correlations between model inputs on cost-effectiveness results in a Markov model. This presentation is based on our publication titled, Evaluating the Correlations of Cost and Utility Parameters from Summary Statistics for Probabilistic Analysis in Economic Evaluations. I thank my co-authors. Now, I will discuss how correlations between parameters impact the cost-effectiveness results. We considered 4 scenarios to examine the impact of modeling correlations in cost-utility analysis. Scenario 1, not incorporating the parameter correlations. Scenario 2, incorporating the correlations between cost parameters only. Scenario 3, incorporating the positive correlations of costs and utilities. Scenario 4, incorporating the negative correlations of costs and utilities. We ran 100,000 simulations to simultaneously capture the uncertainty in all parameters for the 4 scenarios. For each scenario, we calculated the mean and 95% credible interval. The cost-effectiveness results are presented in Table 3. The mean model estimates, total costs, incremental cost, Cowley, incremental Cowley and incremental cost-effectiveness ratios, were similar across all 4 scenarios. The 95% credible intervals for the costs of usual care and PGX, and the 95% credible interval for incremental cost in Scenario 2 were slightly wider than those in Scenario 1. When modeling the assumed positive correlations between the utilities in Scenario 3, the 95% credible interval of Cowley in both strategies became wider than those in Scenario 1 or 2, and the incremental Cowley became narrower. We plotted the probabilities of PGX being cost-effective across various willingness to pay values for the 3 scenarios using the cost-effectiveness acceptability curve. The 4 cost-effectiveness acceptability curves were similar, suggesting that incorporating correlations between costs and utilities had limited impact on the overall cost-effectiveness results in this case. We provide mathematical justification to illustrate how correlations impact the cost-effectiveness results. We simplified example 5 above under several assumptions. Findings in the simplified scenario may be generalizable to most Markov model in general. We present formulae of the variance for costs, Cowley, incremental costs and incremental Cowley in the appendix of our article. The formulae on the left side of this slide are used to derive formulae of the variance of cost-effectiveness results. Now, we summarize the findings. When the correlations between cost components are positive, incorporating the correlations between cost parameters in modeling increases the variance of cost and the variance of incremental costs, compared with omitting the correlations in modeling. When the correlations between health state utilities are positive, incorporating the correlations between utilities in modeling increases the variance of Cowley, but decreases the variances of incremental Cowley, compared with omitting the correlations in modeling. According to our mathematical justification, correlations impact the variance of the incremental costs and Cowley, but not their expected values in simple scenarios. Therefore, in general, incorporating correlations between model parameters is unlikely to impact the incremental cost-effectiveness ratio, ICER, markedly. However, in a nonlinear model involving with numerous random parameters, incorporating correlations between costs and utilities indeed can impact the expected values of the incremental costs and Cowley, as well as the associated ICER. Especially when the incremental Cowley are small, any changes in the expected value of incremental cost can lead to considerable changes in ICER. Thank you.